Can you go a little bit into what type of scientific data and research you're doing? What are you even looking for in biomarkers? Because it is a different, I would say, end game to it. Whereas in conventional medicine, of course, you're trying to manipulate things and actually force reactions within the body. Whereas this isn't a forceful type of reaction. You're trying to heal and regenerate.
Yes. So from the research side of it, there's two areas. One is on the device itself to make sure it's doing what we believe it's doing, to prove that, and to prove that what's coming out of it is what we say is coming out of it. And there's actually quite a lot of science verifying the technology itself. And then the more interesting side for most of us is on the impact it has either on cells in vitro, or on proteins, or on the body itself. And so there's a range of studies. There is testing that's done that's double-blind and placebo-controlled, which everybody likes to hear that, even though a lot of us are like, yeah, you don't have to hit that standard. But, oh, if you do hit that standard, I'm kind of glad you do. And so we've got that research. And then we've also got things like DNA testing for double-strand DNA damage, which is the difficult damage when both strands are broken, and looking at the amount of repair with or without the NanoVi device.
And what are those results showing you?
Those range from the double-strand damage, the measurement's called a FOTC, but it's the points of damage that they can count, were between 15 and 35% lower when the NanoVi device was part of the regime versus when it wasn't. A lot of variation. And so some people are much more vulnerable to that damage than others. And that's one thing about our device in general. And you might have noticed this clinically, is some people, it will just have a dramatic impact. They're buzzing with energy or whatever. And then other people, they're like, well, that feels good, but it's not such a big deal. And it's because the device only helps the body do what the body needs to do. And everybody's different. And some people have acute needs, or some people they're sort of close to the edge or the threshold, and you can click them over and suddenly they have great mental clarity and they're just, so focused. And then other people, they're, it's more of a continuum, and they'll notice it over time, but they might not have as big an impact the first time they use it.
It's so true. And again, this is the core of everything we do, is personalization. And yes, you are different person to person, of course. But some people, while getting this, and we usually have them regardless of any therapy they're doing, IV, whether it's another oxidative therapy, they're hooked up. We have 4 or 5 of these always going, and everyone's getting their NanoVi treatments. But what are some, you said, some feel the energy, some feel a little bit of a cognitive boost or mental acuity. What are some other things that people are feeling, just for someone who's wondering, what can I possibly feel from all of this that you're talking about in the science and data?
You mean that I can talk about?
That you can talk, yes. That is not healing, not treating, not diagnosing, that whole written statement.
Yeah.
Yes.
We have, the biggest one is probably sleep, where people notice I just slept like a rock. And that's balance in the autonomic nervous system. And that's another one that you can do so easily as measuring heart rate variability. And you interviewed Michael Kessler about heart rate variability previously.
I did indeed. It goes hand in hand, right?
He see, they get it. And that's an easy way to kind of gauge the impact of the NanoVi, because people will settle in. Their autonomic nervous system will come back into balance. They relax, take them out of the stress mode. And that's just so important in general for everything else, for immunity and everything else you're trying to do. And so that's an easy one to measure, and it's an easy one for a lot of people to feel.
Yeah.
Because by and large, we're overstressed.